The last learning objective is to describe how over-the-counter products should be used in the treatment and prevention of urinary tract infections. So when it comes to over-the-counter products, a lot of people are interested in cranberry products, so juice or tablet. And this is essentially the idea behind this is that cranberry may inhibit adherence of uropathogens such as E. coli to urinary tract surface. If so, it may be able to prevent urinary tract infections. Now, historically, there's been limited clinical data on this. Back in 2013, JAMA released a clinical evidence synopsis. So essentially, the question they were asking, are cranberry products such as juice, tablets, capsules, and syrup associated with prevention of urinary tract infections compared with placebo or other treatments? And the conclusion at the time was that cranberry products are not associated with prevention of UTIs. However, lack of association of cranberry products with a reduced incidence of UTIs in clinical trials may be due to lack of participant adherence, lack of sufficient active ingredients in the cranberry product, or lack of sufficient statistical power. This actually led to an RCT that was published in JAMA in 2016. This is essentially was the effect of cranberry capsules on bacteriuria plus pyuria. So this was an objective way of measuring whether cranberry can prevent adherence of E. coli to the urinary tract. So they wanted to test the effect of 2 oral cranberry capsules once a day on presence of bacteriuria plus pyuria among women residing in nursing homes. And essentially, they found no statistically significant difference between placebo and cranberry. In fact, an editorial was published in JAMA, and essentially they said that the evidence is convincing that cranberry products should not be recommended as a medical intervention for the prevention of UTI. A person may, of course, choose to use cranberry juice or capsules for whatever reason she or he wishes. However, clinicians should not be promoting cranberry use by suggesting that there is proven or even possible benefit. Now, fast forward to 2023, there was a Cochrane review that essentially looked at everything that was published on cranberry. So essentially, cranberry products compared to placebo control or no treatment. And overall, they found that although it looks like it may reduce the risk of getting a UTI, there is significant heterogeneity. So they, you cannot conclude that this is evidence that cranberries reduce the rate of UTI. So I squared or Higgins statistic measures heterogeneity. So ideally we want there to be zero heterogeneity, but essentially less than 25% would be okay. This was 69% heterogeneity. With women with recurrent UTI, although the results show reduced rate of UTI, but still significant heterogeneity. So that's why I have this in yellow. In elderly men and women in institutions, the study found no statistically significant difference between cranberry products and nothing. So essentially this crossed, the confidence interval crossed 1, so no significant difference. There is significant evidence to support that this may be beneficial in children, and that's beyond the scope of this topic. We are focusing on adults. For people who have issues with bladder emptying, such as patients with multiple sclerosis, no statistically significant difference. Now, in people who have susceptibility to a UTI due to an intervention, the evidence is clear that it may prevent UTI in those people. So no heterogeneity and statistically significant difference. No difference in pregnancy, and when it comes to safety, also no difference in adverse effects. So while cranberry products may not be as effective in most people, but also they're not causing adverse effects. So essentially, unless people are about to undergo a procedure that will put them at risk of getting a UTI, the evidence is clear that cranberry products are not going to work for the large majority of people out there. And lastly, for over-the-counter products, we have Phenazopyridine. This is essentially a urinary analgesic to relieve the symptoms of UTI, such as pain, burning, urgency, and frequency. Has no antibiotic activity. So essentially, this is just to relieve the symptoms, and people should not take it up to 2 days. And essentially, because with proper treatment, symptoms should be gone by 2 days. So if someone has symptoms beyond 2 days, that could essentially indicate that the treatment is not working. So you don't want to mask that. So you want to make sure that people don't take it beyond 2 days. So if there are symptoms, they can go to their primary care provider or an urgent care to receive appropriate treatment. Now, some of the adverse effects of this could include headache, dizziness, or stomach cramp. And one thing that's important to communicate to patients as part of education is that it does have a dye that can turn the urine reddish. So that's important because, imagine someone who has pain or burning when peeing and suddenly see their pee turn red. They might, that might be alarming. That might make them think it's blood, for example. So you want to make sure that patients are aware of this. Okay, I'm here at my local CVS. Let's see where the pharmacy is. Okay, let's see. Here are the Azo products. There's one for urinary tract infection test. There's one for urinary tract, urinary pain relief. There is, so the urinary pain relief has Phenazopyridine in it. That concludes this presentation.